Hi, I'm Dr. Nicole Vane from Moonlight Beach Dental.
And I'm Dr. Jenna Khoury with the Brush Stop Pediatric Dentistry.
And one of the topics I want to talk about today is the importance of working with a board-certified pediatric dentist. As a general dentist, I just love children. I love treating children. However, there's a lot of circumstances in which they're much better treated at a pediatric dentist's office.
Pediatric dentistry is a subspecialty of the ADA, meaning there is an additional 2 to 3 years of residency that is required in order to become a pediatric dentist. And that's really because we're talking about two completely separate dentitions, meaning we're talking about all the way stages from newborn to childhood, into adolescence, and then into adulthood. So a lot of pediatric dentists will see children all the way up until they're 14 to 18 years old. The reason for that is because we're talking about growth and development. So when I treat a patient, I'm not just treating a tooth. I'm treating that patient for what's to come over the next 10 to 15 years and potentially a lifetime. And that's really, really important because for us as parents to feel comfortable knowing, just as you would take your child to a pediatrician, just as a baby or a child's body is different than an adult's, so is their mouth.
Now, one thing that came up a lot in my practice in the past couple of years is I was noticing I live in an area where we're very focused on healthy eating and a healthy lifestyle. And I had these parents bringing in young children with rampant decay who attested to not having given their children a lot of sugary foods or sugary beverages that can typically cause decay. So I started looking into it. What would cause all of this decay in this healthy family? And what was interesting is over time there seemed to be a connection between, again, going back to when they come out of the womb, the mother's environment, leaky gut. If the mother is mineral deficient, that's passed on to the child unknowingly. So a lot of these kids were developing essentially soft teeth in utero, and then when exposed to normal foods, they essentially weren't getting enough minerals out of their own system either, and they were ending up with even softer teeth and then having a mouthful of cavities even at 1, 2, or 3 years old. Typically, that's difficult to treat as a general dentist, and that's when a pediatric dentist is especially needed, is for some of these more complex cases, because the baby teeth can affect the permanent teeth that are developing underneath.
The other really important thing to talk about is the fact that often we hear, well, they're just baby teeth. Yeah. These baby teeth serve as not only space maintainers. Several baby teeth are going to be staying in the mouth until a child is 11, possibly 12 years old. Mm-hmm. So it's very important if your child is 3 or 4 already having cavities, there is a potential that they're going to lose those baby teeth a lot earlier than necessary and creating orthodontic issues down the road.
And one passion that Dr. Jenna and I also share is that using safe materials, especially on young children where they haven't quite developed not only the immune system, but their body isn't familiar with processing all these harsh environmental burdens. A lot of kids are allergic to metals or very sensitive to it. And some of those metals are going to continue to stay out in their system long after the baby teeth have fallen out. It's very important to have a pediatric dentist who's trained in using the correct materials because they're very technique sensitive, but when used properly, they're much better for the child's tooth. And they're the materials that I would prefer to have in my own child's teeth.
So I urge you to definitely consistently see your dentist. Make sure your child sees their dentist every 6 months for their general wellness visits and checkups, and to make sure that we're keeping everything clean, healthy, and giving your child the best possible lifetime on their teeth.